morning and welcome back in. In this morning's Ask the Doctor segment, we are talking about bladder health. And Dr. Brian Stone, he's a urologist with Walker Baptist Medical Center, and he joins us this morning to talk about that. Good morning.
Good morning. How are you?
It's good to see you. So when we talk about bladder health, I mean, it's not something that you just sit around and talk with people about, but it is something that obviously affects everyone. And usually you don't talk to your doctor until there's a problem. Is that accurate?
Absolutely correct.
So what's the most common?
Men and women both have a problem, but it comes from different things in men and women. Men can have enlarged prostate, which can affect the bladder, make increase in urinary frequency, waking up at night, weak flow, can indicate prostate disease. And in women, overactive bladder syndrome is very common.
And what is overactive bladder syndrome?
Associated with frequent urination, going every 15 to 30 minutes, extreme urgency. Sometimes you don't make time, you may urinate on yourself.
Well, we see commercials now more than ever about dealing with those type of things than we ever have before.
Yes.
And so obviously there's a way to treat it. Are a lot of people going without treatment?
Yes, and I think the commercials you see deal with pads, dealing with the problem, but not the source of the problem.
But there, if you can find out the source, oftentimes can it be corrected?
Absolutely.
So is it a medication type thing, or what are we talking about with some of these issues?
You see a urologist. We do tests on the bladder, and then based on the results, it can be medication, it can be neural stimulators, it can be pelvic floor retraining. We have a lot of things we can do to make you dry.
Now, are they, when you have urinary problems, it's more than an inconvenience, obviously, often. It can lead, if it's not treated, can it lead to something much worse?
Absolutely. Women can have problems with their pelvic floor where the bladder begins to drop and hang out, and the symptoms can be an indication of something that requires surgery.
And we've talked about that before. That's a difficult subject. But it happens to women so often, and it is the embarrassment of not wanting to talk about it that keeps them from seeking help. Absolutely,
and men too. Sometimes it can be a significantly enlarged prostate that needs surgery as well.
So how often, what do you recommend to anyone watching right now? And they may be going, well, I just thought I was getting older. I thought that was what I did when I got older, but it may not be.
I would say for men over the age of 40, you should be seeing a urologist at least once every couple of years, and once you hit 50, annually. And in women, if you're having any symptoms out of the ordinary, you should see a urologist or speak to your gynecologist.
And I guess people, like we said, until they have a problem, they don't come see the doctor. And you could be old and have a problem for a long time, right?
Yes. If you're wearing diapers or pads, you need to see a urologist.
There you go. All right. And I know it's different to talk about, but I know a lot of you watching right now, you're going, okay, that is me. I need to get this work done. Thank you, Dr. Stein.